ಬಂದಿದೆ ಬಂದಿದೆ ಹಿರಿಯರ ವಾಣಿ, ಹಿರಿಯರೇ ಇತರ ರಾಜ ರಾಣಿ, ಹತ್ತೋಣ ನಾವು ಅವರ ನೆನಪಿನ ದೋಣಿ, ಕೇಳುತ್ತಾ ಖುಷಿ ಪಡೋಣ ಹಿರಿಯರ ವಾಣಿ, ಕೇಳ್ತಾನೆ ಖುಷಿ ಪಡೋಣ ಹಿರಿಯರ ವಾಣಿ, ಕೇಳ್ತಾನೆ ಖುಷಿ ಪಡೋಣ ಹಿರಿಯರ ವಾಣಿ. ಇದು ಹಿರಿಯರ ಕತೆ ಹಿರಿಯರ ಜೊತೆ ನಿಮ್ಮ ಹಿರಿಯರ ವಾಣಿಯಲ್ಲಿ. ಕೇಳ್ತಾನೆ ಇರಿ, ಖುಷಿಯಾಗಿರಿ. Hello listeners, this is your RJ Chandana and I welcome you all to Anubhav, a joint project of National Institute of Social Defense, Ministry of Social Justice and Empowerment, Government of India and Media for Community Foundation, implemented by Nightingales Medical Trust. Project conceived by Dr. R. Sridhar, Project Investigator Alok Verma, Coordinators Pooja Murada, Sai Sudha and Kaushalya. Government of India has initiated an elder line toll-free number 14567. Elders or anyone on behalf of elders can call between morning 8 a.m. to 8 p.m. for any questions, queries and support to elderly. Today we have Dr. Anitha Chandra with us, who is a consultant geriatric psychiatrist at Nightingale Center for Aging and Alzheimer's Center. She completed her core and specialist psychiatry training in the UK and returned to India 4 years ago. Her interests are to improve the access to dementia care and improve awareness in the community. She has participated in several public engagement programs to do the same. She also works closely with other specialists in a general hospital to sensitize other specialties about needs of elderly. Nightingale Medical Trust, or NMT, is a professionally managed non-for-profit organization working for the well-being of the elderly and persons with dementia and Alzheimer's since 1998. We strive to strengthen family bonds and promote community-based support system for senior citizens of all socio-economic groups through various innovative and need-based projects aimed towards dementia care, active aging, social integration, empowerment, capacity building, and prevention of elder abuse. The founders of the organization are Dr. Radha S. Murthy and Mr. Prem Kumar Raja. We have Ms. Ramani Sundaram with us to conduct this interview today. Ms. Ramani Sundaram is a clinical neuroscientist and a dementia trainer working as a team lead with NMT. Now over to Ms. Ramani Sundaram.
Hi, Dr. Anitha. So today we are going to talk about dementia. Thank you for accepting our invite. So I'll start with the questions. Is dementia and Alzheimer's disease the same or different, and in what way?
Thank you for inviting me for this conversation, Ramani. Very interesting question there. Dementia is an umbrella term where your brain is degenerating basically, and it can happen for multiple reasons. Alzheimer's dementia or disease is a type of dementia, and that is the most common dementia that we know of.
Right.
Yeah.
Right. Okay. Doctor, we have heard that it could be hereditary. Is it true?
The most common type of Alzheimer's disease is due to aging. Age is your biggest risk factor, right? Now, hereditary factors do play a role and increase your risk of getting dementia. So, if you have a first degree relative who has had dementia, you are more likely to get it along with other risk factors, not necessarily due to it. But we cannot say the same thing for young onset dementias. For early onset Alzheimer's, frontotemporal dementia, and some other rare forms of dementias, hereditary factors do play a large role.
Interesting. As you spoke about young onset dementia, is dementia specifically a disease of old?
Majority of Alzheimer's disease, which is the most common cause of dementia, is a disease of elderly.
Okay, okay. And what are the early signs of Alzheimer's disease, doctor?
Now I would always like to compare Alzheimer's disease or dementia to pregnancy. It is very hard to catch at an early stage because it will be passed off as normal aging because it is an age-related illness. So what happens is you might have some slips of memory. This is the most common, or an isolated incident of missing the way, misplacing things. When these symptoms start affecting a person's functioning or has caused a major trouble in the way that they live,
Right.
that is when we generally pick up.
Okay.
Right? So, in some cases, it is problems with thinking, making decisions, difficulty in understanding, difficulty in concentrating in certain aspects, or doing simple math, or able to do their day-to-day transactions in a bank or the shop. These are the things that predominantly get affected. But it is also not uncommon to see people to have personality changes where they family come and say that he's not himself, he gets angry too soon, he gets aggressive with us, or he started spending too much, or he's losing control, not finding the right words is another common complaint that people do talk about. Other than that, there are mood symptoms where they kind of, have depressive feelings or apathetic. Some people do present with hallucinations and delusions too. So it is very hard to put a finger on what starts off, but majority of the time it's simple memory problems.
Right, right. That's very interesting because I think when we talk about simple memory problems, in many times it could be categorized as normal aging. So, how can a person who has some sort of a memory loss get themselves screened for dementia?
Ramani, this is a very important area for intervention, and something that we have to pay attention to. Alzheimer's or dementia of any kind has got preclinical stage, and preclinical stage is what we call as when we closely observe that your elderly or the loved one with who's over 60 or 65 has got place for some interventions which can buy them few years of independence. And I would say this stage, but offering, we have multiple elderly packages, but none of the elderly master health checks ever offer memory screening. This
Correct.
would be the good starting point according to me. So a memory screening, even a mild one, we can then investigate it further by detailed cognitive testing. And there are treatable dementias, like there are some vitamin deficiencies that contribute to memory problems. There is depression, which is very common in elderly, that contributes to memory problems.
Right.
There is alcohol excess. There is repeated, the vascular events in some people who have got vascular risk factors like hypertension and diabetes, which with poor control they develop memory problems. All these are contributory factors towards developing Alzheimer's. So these things can easily be treated, and a person can remain without progression of those symptoms. So that screening is something that's
Right, right. What would the screening usually involve?
the screening that would be normally what happens is a neurologist, a psychiatrist, or an elderly physicians. These are the people to generally, people go to normally, and they do complain about their memory problems. So, few things that I mentioned in the earlier questions are incorporated into so-called dementia screening. That is, they check for their uh, the physical symptoms, their sugar control, their thyroid levels, calcium levels, vitamin B12, folate, um, vitamin D levels. There is also chronic inflammatory conditions that can
Right.
contribute to memory problems. So there are CRP levels. There is also some sexual illnesses from the past. So VDRL, these are the things that are checked as the blood tests. And they also do CT or MRI. Most likely MRI is more helpful to check if there are brain changes like shrinking, specific parts of brain that are shrunken. So that way we can identify if an Alzheimer um, pathology has started or not started. Most probable, again, the correct way of diagnosis is not possible, but we will be getting most probable diagnosis with these kind of um, tests. Alongside all this, the most important thing is what we call as cognitive screening. That is, we do memory testing. We call it memory, but there are various domains that we test for, like language, attention, concentration, visuospatial skills, long term, short term memory, calculations, fluency tests. These are tests that give us idea about how a person's brain is functioning and which areas are already compromised. By this way, we will be able to establish a baseline functioning for any person, elderly person. All these things put together will give us some idea about somebody's possibility of developing
Yeah.
and dementia on it.
So an elderly with memory loss could just possibly take at least the cognitive screening at the first place, which is just a paper pencil based test where there are just certain questions that are being asked, and they could just see how is their cognitive function as such, and if there are some issues, they can then look into further evaluation as you suggested.
Correct, Ramani. That's the message.
Doctor, is dementia treatable? Is Alzheimer's disease treatable?
Oh, Ramani, I don't know how to answer that. But dementia, if you ask me a specific question and a specific answer to that, no, it's not treatable. Is it manageable? Yes. Like any other illness, like hypertension, like diabetes, like any chronic illness, rheumatoid arthritis, we don't treat it, we don't cure it, but we manage it. Similarly, Alzheimer's disease can be managed. Living well with dementia is the concept. How do we live with an illness with a quality of life? That is what we are all trying to achieve.
Right. And when we talk about management, what sort of management are we talking about, doctor?
See, Ramani, we discussed about what all we are going to screen, right? So these are all treatable factors. So we are going to treat if any of these things are affected. Like for example, if thyroid is not good, then you treat thyroid condition so your thinking is faster and you're functioning at an optimum level. Similarly, B12 deficiencies contribute to somebody's thinking abilities, remembering abilities, so we treat that with appropriate medications. And what we call this as, whether it is sugar control or cholesterol levels, these are all factors that increase the risk of dementia. Because in Alzheimer's, what happens, your nerve cells are dying, or rather degenerating and becoming what we call as plaques and tangles, right? Now there is another side by side process that happens, that is your arteries are also getting blocked and causing mini strokes or vascular changes, what we call in the brain. That also contributes to the loss of functioning of the brain. So if we control the blood pressure, diabetes, cholesterol, not only is your heart functioning well, your brain is also functioning well. So that is the mantra. There is also other inflammations. Some studies have shown that inflammation is the reason that brain cells automatically become plaques and tangles. So if we address some chronic inflammation that can be happening, these are the ways of handling dementia. There is also mental health conditions, like somebody with depression can develop dementia. So treating, and depression is treatable. So treating somebody with depression, their risk of developing dementia will come down, right? So these are the ways of managing.
Right. Are there any licensed drugs that could be used for dementia per se?
See, there are definitely some pharmacological therapy that we can use, and these medications are shown to be delaying the onset of dementia. Now, what does the Alzheimer's do? It takes away your personality and it takes away your cognitive ability that you will not be able to care for yourself. So, let's say if it is delayed even by few months or years, that is an added, advantage for somebody. So, these medications are called cholinesterase inhibitors. So these medications do contribute towards improving quality of life and delaying the onset of dementia when started in preclinical and early stages.
Wonderful, wonderful. Doctor, as you spoke about the treatment, saying that there's no cure for dementia as such, but it is manageable. Given there's no cure, how do we encourage people to get themselves screened for memory loss? If at all they have a memory loss, how do we get themselves screened? And given that there's a lot of stigma around dementia itself, so how do we address that?
Ramani, you've brought up a very interesting topic. It is not only um, stigma. The sorry, can you do that? I think I started it. Ramani, what we need to know is whenever there is lack of awareness, there is stigma attached to it. If you see ages ago, people with diabetes also were not married. People with asthma were told you cannot get married.
Right.
That was because of lack of awareness. We are in that stage with regards to dementia, right? So the more the awareness improves, the stigma will be demystified by itself. And we have stigma at various levels. And one is by denial. One is due to denial that there is no dementia. It is all aging.
Right.
And who invests in aged person? That ageist attitude is also there. So all these things has to change. And stigma, because as I said in the earlier segment, some of the symptoms of dementia is also psychological symptoms. And you know very well how much of stigma is attached to any mental illness, because if they have low mood, if they have delusions, hallucinations as part of dementia, people are in denial, and they do not want to believe a brain condition can cause all this. We are basically removed from the fact that brain and mind are linked.
True.
And
true.
I think this is the major cause for dementia, and we don't like to acknowledge mind symptoms.
Right.
And with regards to Alzheimer's or dementia, I think we have to go on a big awareness drive, openly discuss, educate our younger generations. I talk about these middle-aged people who are professionals. I think we have to empower them with a lot of information to look after their elderly much better.
Correct. So, doctors, you being a geriatric psychiatrist, are there any platforms or are there any ways that these elders can actually go and get themselves screened, maybe perhaps in a confidential manner?
Ramani, this pandemic has really opened up a lot of avenues. I must say it has been very difficult 2 years, but it has also been a very innovative time for mental health. And the number of online mental health platforms that have come for various other adult disorders to now elderly is also one of the things is started by Nightingale's Medical Trust called DEM Clinic. This is a fantastic opportunity for anybody who's concerned about their elderly or they themselves, where they feel they're offering initial assessment and screening for free. I mean, this is quite an expensive assessment if you go on a private practice seeking it out, and that's offered for free. They have empaneled a lot of psychiatrists onto the platform, so you can have access to some of the best practicing old age psychiatrists in the country. So these things have come up. Even doctors, psychiatrists are offering online assessments. So they can't get more confidential and easier than accessing these kind of assessments from the comfort of your own house. By no means they 100% replace a one-on-one, but at least it is a start. I think things will get much streamlined and better serviced as the time goes by.
Wonderful. Doctor, why are we talking about dementia so much right now? Though we do agree there is lack of awareness, is dementia such a huge problem for India?
Ramani, dementia is a big problem for the entire world. The world has recognized it. You know that European Western countries, or even the Far East countries like Japan, have aging population more than compared to younger population. India is on that moving on to that side with a better population control. We are now an aging population. Our estimated you know population aging population will reach the 25 times more in about 10 years, and if we do not act now, we will be in a big trouble, because people will live with dementia with poor uh,
Access to services, maybe?
services.
Yeah.
Yes, so that will not be good for the country. Dementia causes disability, dementia causes dependence, and that is not good.
Correct. I was just going through certain reports which says that internationally, like every 3 seconds, there's someone who's getting diagnosed with dementia. The recent WHO report said that there are about 10 million cases of dementia
True.
added every
True.
year. India itself is saying that there are about 6.1 million people with dementia.
Correct.
Given that only 10% of people ever get diagnosed.
You're
You know,
100% right on that
right.
numbers.
Right. So
100%.
as you said, probably we have to increase the rate of diagnosis to probably make the treatment better. And as you rightly said, the societal cost of looking after someone with dementia is also huge.
Correct.
Yeah,
Correct.
yeah. So, Dr. V, I think we've spoken a lot about dementia. I think to look at the brighter side, is there anything that we can do in terms of prevention? What is it that we can do to make sure that we do not get this disease? Perhaps I know that there are no proven prevention techniques as such, but there might be some strategies that might be very helpful. Can you throw some light on that?
Prevention will have to be at multiple levels, Ramani. The thing is, we can individually, like I say, education is the key. Improving awareness and education is the key. I think our prevention strategy should start early on. Like I say, middle age would be the right time to start, and a person with better sugar control, better heart, uh, nutrition,
Yes.
exercise is one of the most proven strategies in preventing dementia. There is enough and more research evidence to say that having about 30 minutes of moderate exercise 2 to 3 times a week will be more than enough to keep your heart and brain happy, right?
Right.
And there is also food rich in
Omega-3 fatty acids.
yes,
Yeah.
these are foods that
Yeah,
tend
yeah.
to what we call as what these kind of foods, what it does is reduces inflammatory reactions in the brain, and it helps with better neuronal connections and things like that, so which is anyway good for your brain health.
True.
And there is also, like I mentioned about inflammation, right? Reducing inflammation. The multiple strategies to reduce inflammation, like some talk about diet, some talk about anti-inflammatory, like going on aspirin and things like that. Any school of medicine which promotes anti-inflammatory will be good.
Right.
The one of the other most neglected thing is sleep hygiene. Sleep is a very important role in clearing of amyloid plaques. They have said that people who have poor sleep also have, it has been proven that they develop cognitive deficits much more early.
True. Yes.
So I think to correcting your sleep, one way or the other, which is most, doctors can identify what sort of sleep disorder you have, and then treat and get all those addressed. This is one way of personally somebody addressing their own brain health. The other ways is, obviously education to the colleagues as well, our own medical colleagues, being in tune with somebody. It's more common for an over 65 to have more confusions post surgery, post ICU admissions, or when they're unwell, to just to kind of think about, could this be dementia? So sensitizing every section of our society. It takes a village to raise a child, and so does it takes a village to look after an elderly. And as a civilized society, we have to do that. We
Yeah.
need dementia friendly services. Everybody has to start thinking about, oh, I see somebody who's looking a bit lost, and could this be that, and should we be attending to them? Or if you have a person who's left his newspaper out and not picked up, who's your elderly neighbor, somebody has to think, this is
Is
not
there
looking,
something
there is
wrong? Yeah.
changing.
Yeah.
So prevention, I talk both in medical and societal terms, that we have to be a lot more in tune with a lot of things to
Interesting.
address things.
Yeah, yeah,
Yeah.
correct. And Doctor, adding to what you already said, I think also right now there's a lot of buzz around, keeping yourself socially connected, talking to each other, and I think also, doing some sort of, mentally stimulating activities. Even I think even that is quite helpful, isn't it, Doctor?
You're absolutely spot on that, Ramani. Yes, social, I think I forgot to kind of talk about that. Social stimulation has got the best, what the stimulation for the brain. We have what is known as cognitive stimulation therapy for people with cognitive difficulties or dementias in our centers. We, as much as we talk about exercise, there are two important aspects there. One is exercise and one is social stimulation. Social stimulation lights up your brain in very different ways, and that anything that lights up your brain in different ways is good for your brain. So isolatedly, a person sitting in sudoku to going to meet a set of friends or people and playing a housey, which might not be that highly stimulating. If you compare the two, probably going and being in a company and playing housey will be good for that elderly person.
Definitely, definitely.
So I would be, loneliness is a biggest another problem amongst elderly, and that really robs them of a lot of cognitive abilities. So creating opportunities for elderly to mix and to socialize is the utmost important thing. And structured, and for already diagnosed people with dementia, these cognitive stimulation therapies are promoted in active aging centers like the ones run by Nightingales. They are conducted by psychologists, and they have a particular protocol of doing it, and they mix both cognitive and physical gym activities, if you want to call it that way, and that really helps in somebody's improvement in their functioning. Yeah.
So wonderful, Doctor. I think as we have spoken a lot about prevention, I think a lot of people will have doubts that there are many famous people who have done all of these that we spoke about as preventive activity. Probably, having good education, keeping yourself active socially, mentally. Like we talk about, say, Ronald Reagan, Margaret Thatcher, or MS Subbulakshmi. But they did went on to develop dementia. So, what does it tell about the situation?
Ramani, you've asked again a very important question. Like I said, nobody is immune. Aging is the one major risk factor for dementia. And when I say major, it is major.
Right.
Nothing, everything else, like I said, we don't know the cause of dementia. Everything else we discussed today is a contributory factor.
Understood.
Right? There are protective factors, like you said, keeping yourself active, education levels, right? Good nutrition. Everything that we've spoken are protective factors, but they are not going to stop it from coming if you're prone to getting it.
I understand.
So does these famous people. It's fantastic that these people said that they have had Alzheimer's. And we need many more such names to come out for people to. You asked me a question about stigma. Apart from these names, can you name many more people? There are a lot more people, famous celebrities who suffered from Alzheimer's, but we don't know. Nobody wants to disclose it. Such is the stigma attached to it. I think people should start reporting it, should start treating it as a normal issue, and come forward for studies to prevent it, and whatever comes through uh, the correct way of investigating and research, support such activities, we will be able to win over Alzheimer's one day. I'm sure we will find a cure.
Wonderful, doctor. I think that I would want to ask you one last question as we close this session. So, you know that this is going to be listened by a lot of elders. What is it that you want to tell them, as they all are in the age group which is more prone to dementia? And you've already put it that by keeping themselves active, they can reduce the probability. If at all you want to leave them with a message, what that would be?
See, this is a message not only for elders but definitely for my parents too, because they are in that age group. Elders have to learn to plan their retirement. A lot of our Indian parents live for their children, and I think they have to plan it for themselves. Plan it in such a way that they are active, they are enjoying, and they are able to attend to their needs first. This is the first thing I would say. Second thing is, do not hesitate if you do have depression, because depression can be treated, and seek out help, because that does impact your dementia onset. Second thing is, pay attention. Pay attention, and there is nothing wrong if a close family member points out you're forgetting. Accept help, get screened. That is the first starting point, because that screening place, whichever that I spoke about, the age care, resources we have, always is connected with a lot of support groups as well, right? Whether it is DEM clinic or some other clinics established by others, they are always linked up with support services. Yes. They are able to link you up with support services, if whether you are diagnosed with one or not. And you being educated, you will pick up. It's a chain reaction. So look after yourselves and look out for others who might need help amongst you. Support each other and seek help. That's all I would like to say.
Wonderful, doctor. So I think, though we may say that there's no cure for dementia, we'll just leave it at there's still hope, there's help. So people should get themselves screened, keep themselves active physically, mentally, and socially. That's wonderful, doctor. Thank you.
Thank you, Ramani.
Thank you very much, Dr. Anitha, for throwing light on dementia and dementia management. All our questions were well answered. And we also thank Ms. Ramani for asking thoughtful questions. Once again, we thank both of you for such a lovely session. We look forward to have many educative programs like this. Thank you. Listeners, I hope you all enjoyed this interview. Stay tuned to Hiriyara Vani for more such programs. Government of India has initiated Elder Line toll-free number 14567. Elders or anyone on behalf of elders can call between morning 8 a.m. to 8 p.m. for any questions, queries and support to elderly. Bye for now. Take care.